All right, let's get to the main event. Look at this. I have Senate President Dominick Ruggerio in this corner. And in this corner, I have House Speaker Joe Shekarchi with me, although you're not fighting each other, right?
Never.
We're all going to get along here today? Excellent. Nice to have both of you back, by the way, instead of the Zoom stuff we've been doing.
Nice to be here.
Thank you for inviting us.
You're joining me on Thursday. Well, we just got news a couple of minutes ago. The president is sending healthcare workers, doctors and nurses to Rhode Island Hospital, and a couple of other states hard hit by the pandemic. What do you make of that, Speaker Shekarchi?
I'm grateful that the president's sending it. We need them. There is a crisis in healthcare right now, so we'll take any opportunity for assistance we can. And I'm glad that the president recognized Rhode Island and sent the resources we need. And I'd like to get more, quite frankly, if we could.
Okay, per capita, we're #1 for COVID, Omicron cases. And we've got problems getting enough testing. So that we have some problems here, Senate President Ruggerio. Now we're getting military health care workers from the president. Has anybody dropped the ball in your view?
I think we should have planned a little better. We didn't expect the Omicron to be as infectious as it is at the time. We can't really blame anyone because we don't know where this virus is going. We didn't know a variant was coming. We didn't know what was happening. So I can't really blame anyone. I wish we had kept our testing centers up a little longer.
Yep.
But hindsight is always 20/20. So I just think that the governor has done a great job trying to get people immunized and asking them to get immunized. And that certainly has helped us. Let's keep in mind that we are the most heavily tested state in the country, and that's probably the reason why we're seeing so many upticks in the surge in the Omicron.
Mm-hmm. Okay, so you think the planning could have been a little better prior to Omicron?
I think it could have been a little better if we knew what was going on, but as I said, it's difficult to follow this particular situation, especially not knowing the effects of the Omicron.
All right, you know, we're taping on a Thursday. We just got word that Dr. Nicole Alexander Scott is out. She's leaving. I don't know why. There's no reason given. I do know, as I said in the introduction, she's butted heads with the governor on guidelines and masks, and there was an embarrassing leak of a memo from the health department, came out a week ago, very embarrassing to him. Do you know more about this than I do today?
Only what I heard in the news. I did speak to Dr. Alexander Scott this morning. I asked her to stay. She said that, and I think, quite frankly, she's done an outstanding job for the state, the people, her department, everything else. I can't say enough good things about her. I asked her to stay. She said she had given everything she could in the 7 years she's been here, and that it was time. She's planning to stay on for a period of time to help with the transition. She was concerned about the health department. She wanted to make sure that we had committed as a state to a new health lab. They're operating in a very inferior facility. We have made a commitment that we don't know exactly where, but there will be a new health lab in Rhode Island. We need one desperately. We're going to build a brand new facility, and I wish her the best. And I just want to say on behalf of all Rhode Islanders, thank you, Dr. Alexander Scott, for everything you have done for our state.
Well, she became a fixture here under Governor Raimondo, but it's my job to get to the story here. Why is she leaving? There's nothing in the press release that says she's going on to bigger and better things. Is she out because she butted heads with the governor, Senate President? What do you know? You know everything.
I don't. I wish I did, Gene. I don't know what her plans are, and I spoke with her earlier today, as the speaker did, and she was very gracious. I think she's done an absolutely phenomenal job here. Keep in mind, she's an epidemiologist, and they're hard to find, especially in light of the COVID virus.
But Speaker Shekarchi, we know she butted heads with the governor, and I know people who were tight with the governor. They thought he should have, asked for her resignation when he took over, because he had a little tough times with her. And you know that over masks and other guidelines and the leak of that memo. I don't know who leaked that memo, by the way. Do you have any ideas?
I have no idea, but the questions for your answers are really not for me and the president. They're for the governor and Dr. Alexander Scott. I don't know why she's leaving. I take everybody at face value. Right. She told me she had given everything she had to the job, and I believe she did, and it was time, and I accepted that response.
All right. You've also accepted both leaders here, that the governor basically runs the show. This goes back to Governor Raimondo, and the Republicans, Blake Filippi in particular, have been very critical of the both of you turning everything over to the governor under executive orders. He's gone so far to say he doesn't think it's legal, although the Attorney General assured me it's legal, don't worry. But speak to this philosophy. Raimondo and now McKee, they run the show.
What do you mean they run the show?
Other executive orders, they decide how long kids wear masks. They decide everything with regard to COVID.
The Constitution is very clear. We're in a pandemic, and the Constitution says the governor has the authority to set those guidelines. When we're in a pandemic, one person has to be the person in charge of the state, and that person's the governor. And the Constitution is very clear about. State law is very clear on that. So there's nothing to really challenge or take it over. So we accept that, and if there's something that goes awry, then we would come in and we would limit that or take appropriate action. But so far, he's fit well within the governor's, both Governor Raimondo and Governor McKee's guidelines and executive orders have felt within the confines of the law, and there's no need to override or change them.
All right, Senate President Ruggerio, you've heard Blake Filippi and others complain that this has gone on for too long.
They complained when we didn't do anything, when the pandemic initially happened. Now we're taking a look at everything, especially the money that's coming in, how we spend this money. The Speaker was perfectly clear, and he has been clear ever since. We are going to monitor the expenditures as far as the money coming in. Obviously, we let the Governor Raimondo handle a lot of things because it was a time when the virus just hit. And we didn't know what was happening at that time. Right. But now we have some money coming in. We want to spend it. We want to be very frugal and prudent as to how we spend it because we want to make sure that in the outlying years we can help our economy.
You're moving to the money, and I'm going to get to that in just a section. This is the $1 billion that came in care relief. But just a couple of minutes ago, you told me you weren't happy with the planning, and that's on the governor. So are we trying to have it both ways? You know, I have to tell you, if I was in leadership, I would say, go ahead. It's theirs. If they screw it up, don't come back to me. The governors are running the whole show. It's very convenient, but you said you didn't like the planning. Just address that, and then Speaker Shekarchi will get you right back in. Go ahead.
Yes, that's correct. It's not a question I didn't like it. We just didn't know what was happening at that time. However, a number of my colleagues have come up to me, and they've expressed their sentiments as to how we handle the money, where the money's going. You got a lot of people in this state know how to spend $1 billion, but I think we have to just keep an eye on that money for the future.
Okay, Speaker Shekarchi, go ahead.
Well, let's back up. So when you talk about the pandemic and the executive orders and the governor, when President Trump and the Congress 2 years ago enacted the CARES Act money, they were very specific in that all of that money through all 50 states would be spent by the governor. We were just at the very beginning of a pandemic. No one knew what COVID was. No one knew how serious it was. We didn't have vaccines then. We needed to get money out and relief out to workers, to people, to hospitals, to nursing homes. And that's the way Congress sent the CARES Act money. We just finished the CARES Act money in December of 2021. So that money was spent, and all the governors of all 50 states had exclusive control of that. The ARPA money, what the president is talking about, is money that the Congress also has sent to us that we, as a General Assembly and all the legislatures throughout the country, will have oversight over. It'll be spent on normal course of our budget process.
Right. You're absolutely right. The first tranche of money that came in,
yes.
Jack Reed got us a lot of money.
We did very well. Rhode Island hit above its weight.
And Governor Raimondo, it was hers to spend. In fact, Governor McKee, he complained about that, as I recall, but it was her money to spend. This is the second tranche of money, and you've set us up very nicely for the next segment. You're sitting on about $1 billion. Let's get to that next and how we're going to spend it. Welcome back. Good spirited conversation with the Senate President Dominick Ruggerio and the Speaker of the House, Joe Shekarchi, both Democrats. All right, you set us up now. We got about $1 billion what was it? $1 billion point?
Yeah, 1.1 billion.
1.1 came in ARPA money.
That's correct.
This is pandemic relief money that you decide how to spend with the advice of the governor. He'd like you, but you have oversight of that along with the Senate.
It's a collaborative process. And as you know, last week we spent $119 million. We gave relief to our community, our small businesses, our social service network. The governor, to his credit, spent what was left over in CARES Act money in the month of December for EI, which is early intervention, and also for some child care that the president was interested in. So we have spent that money appropriately, accordingly, and we'll do that same thing again. That money, that 119 that we spent, went through the normal budget process. There were hearings, hearings in the Senate, hearings in the House. We had an ARPA committee also, had hearings all throughout the summer as well. It's about process for me. It's about being open, transparent, and let people know what we're doing with this money. And this $1 billion that we have left over will also go through that same process. I think it's prudent not to spend it all in 1 year, but I think we'll have that discussion along with our counterparts in government. The federal government gave us 4 years to spend the money. We're only in year 1 of that.
Okay.
So we need to say, nobody can predict. If Omicron taught us one thing, is that you can't predict the future of COVID. So hopefully we'll get by this Omicron in the next 30 to 60 days, but we don't know what's down the road in the next 60, 90, or 120 days.
Right.
So we have to be prudent with taxpayer money.
I know you bristled a little bit when the governor was suggesting that you weren't spending it. You too. You were you pushed back there. Well, I'll spend it in due course and due time after we have our hearings. Are you satisfied that you're spending it in a timely fashion? The first $100 million went out, Senate President.
Absolutely, absolutely. I think we did. We vetted the whole process, and I think we came up with a lot of good resolutions. And I think we did a very good job on that. And that's, as the Speaker said, that's how we're going to do it. We want an open and transparent process that the public can see where that money is going, because that is a lot of money for us.
Let me finish my point on that. The governor requested $113 million. He got everything he requested. It wasn't like we withheld anything. We actually increased to $119 million, put more money in child care, because the president and I felt, quite frankly, that that was where the need was at that particular moment. So it's not like we were playing games. And I point out that budget request came in, and within 60 days, we had an agreement to pass that money. To spend $119 million in 60 days is not delaying it.
Okay, educate me. What is this money for? Because, you know, I speak to people and they say everybody's got their hand out. What does the pandemic have to do with homelessness? What does the pandemic have to do with affordable housing? What does the pandemic has to do with these issues when all of Rhode Island was hurt to one degree or another? All of us, by the pandemic. Answer that question, because it seems like the needy have their advocates and they have their hands out. Go ahead.
So there are over $4 or $5 billion of requests for the $1 billion. We have a portal, and as you point out, everybody.
You have
$4 to $5 billion.
4 times the amount that you have.
Yeah, and I believe there'll even be more coming in. The AFL-CIO has a plan. The Rhode Island Foundation has a plan. Every day, Rhode Islanders have a plan.
Okay.
Every organization has a plan. It's all on the General Assembly website. You can hit the link and you can look at who asked for and how much they've asked for. So it's all public. That was very important to the president and myself, that we be very transparent of who's even asking for the money. That's the first thing. This money is to address people who've been affected by COVID, and that's a very broad-based thing. One of the reasons why we were, I guess, a little bit slower than some of the other communities is we were waiting for guidance from the federal government on how and what you should spend it on. We just recently got guidance. Now, some states had an immediate need, and they spent it right away. To their credit, that's fine. We waited a little on the slower side, but that was to our benefit. We received an additional $71 million from the Department of Health. There were many instances where, by being a little bit cautious on it and a little bit, frugal on how we spend it, we actually got more money, and that's to the benefit of the state. So who gets it? Anybody and everybody who was affected by COVID. We will follow the guidelines as given to us by the federal government, and we'll go through an open and transparent process to that.
Senate President, expand upon that. You know what I'm getting at. We had a homeless problem before the pandemic. Why is it going to the homeless? Why is it going for affordable housing when it's not going to every single Rhode Islander? The stimulus money, the child tax credits, that was a pretty broad brush the president painted with. Go ahead. Who's it for?
Well, I think when you look at everything that's happening, I mean, the virus has affected everyone. We had homelessness before that.
Right.
We had a lack of affordable housing before that. We're focused on those issues as we have been over the past few years. But the virus, exacerbates a situation like that. It leaves more people homeless, and more food insecurity. It's a whole bunch of things that are associated with that. So that's something where, obviously, as the Speaker said, we have to provide financial assistance to those individuals and to those businesses that are in need.
Okay. I only have about a minute left. Bang through a lightning round for me. Recreational marijuana, it will get passed this session? Just a yes or no will do?
Looks likely. I don't want to commit because we still have to go through a process. We've worked on it all summer. It's very probable you'll see some kind of a bill by the end of the session.
Driver's licenses for illegal aliens, yes? or no?
The Senate passed a piece of legislation, sent it over to the House. I'm sure that we'll be discussing that issue in depth during the legislative session this year.
You talk about that too. Just take 30 seconds, and we'll have a whole other segment, but flesh that out for me.
So the Senate did pass it last
Yes.
year. It came out after the budget was passed. There was a fiscal impact. We didn't account for it in the budget. We're going to have public hearings on it. We're open to listen to that argument, pro and against. There's people who feel very strongly. We're going to have hearings on it. We're going to have it under consideration.
We talked about the driver's licenses for illegals. You know, that's very controversial because a driver's license is a privilege. And some people say, how can you give a license to someone who doesn't belong in the country to begin with? How can you do that?
So first of all, it's not a license, it's a permit to drive. And because undocumented people are already here in Rhode Island and they're already driving. So the reason you permit them is so they can get insurance and so they can drive legally and hopefully help the workforce. So we will look at that, we'll listen to them. If people feel strongly, I welcome them to participate through the process and we'll hear all those points of view. But I want to point out that undocumented have licenses in Connecticut for several years. There's been no major problem. It's happening in Virginia, they have it. There are, I think, 18 states that permit, and that's the difference between a license, because a license implies it's used for identification, other purposes. A permit would simply allow a person to drive, to get insurance, because the one thing you don't want is to have an undocumented person or an uninsured person cause an accident and there's no redress for the injured individual. And second of all, it'll hopefully, we have a labor shortage right now, and hopefully this will encourage people to get back into the labor market.
I know Massachusetts and Connecticut and the other states all have legalized marijuana. We've been slow on that. It's going to happen?
I think it's going to happen this year, yes.
All right, let's move to other things. Kennedy Plaza is a mess. There's been a plan to get those buses out of Kennedy Plaza for years. They want to build a station down the street by the courthouse. Do you support something like that?
I support it as long as all the stakeholders are involved, that we find a solution that works for everybody. The latest plan is the one you're talking about. It seems to have much more broad-based support than the initial plans. So we'll look for it as we go forward. I know the City of Providence has ARPA money. We talked about the ARPA money that the state has. The cities and towns have $500 million as well, and I think that'd be a great allocation, maybe a partnership with the state and the city regarding that. So I am generally supportive of it as long as all the stakeholders participate in that process.
Let's stay in the same neighborhood. I look at the Superman building. It's empty. It's been empty for years now. Councilman Igliozzi, the council president, last week said, "Oh, you're going to get news on that. You're going to get news of a state and city and partnership that we're going to maybe a mixed use for that thing with apartments and everything else in there." What do you know about that, Senate President?
I've heard talk about it, obviously. I have not seen any structured plan as to how they want to go about financing that particular project. They've talked about using it a multi-purpose facility. They'd like state participation, from what I understand, but I haven't seen a concrete proposal at this point in time.
Do you know anything about that further?
A little bit that I heard about it. I have not been briefed with any details of it, but I do know there are discussions going on between the Commerce Secretary and the developer and the City of Providence. And from the little bit that I'm aware of is that they are trying to structure a deal that would require no additional authorization for funds from the General Assembly. They would use existing programs that are available to anybody right now, and there'd be a big component from the city as well. And obviously the developer would put money in as well. Okay. So I generally supportive of that. I think that's a beautiful building. I think we should try to preserve it. It's part of our heritage in Rhode Island, but I'm concerned about allocating new funds for that. So if they can work out a deal that's within the structure of already existing programs, I'm in support of it.
Okay, so something is afoot. Let's talk about the hospital merger, Care in the Wing and Lifespan getting together. Blake Filippi said that years ago, partners wanted to come in. It would have been good for the state. They would have boosted that hospital, but Brown knocked it down because Partners is with Harvard. They didn't want the competition, and Lifespan knocked it down, and Governor Raimondo was in the mix, and that's why we have this big delay. Where do you stand on this merger, and do you buy Blake Filippi's explanation that Partners was a better deal years ago?
I don't think so. I'm kind of not familiar with the whole concept of Partners and their involvement. However, I think that the proposed merger for Lifespan, we have to take a very close look at it and see how that is going to affect some of the people that are paying insurance premiums and things of that nature, a lot of the businesses, the staff over there, they're having a problem staffing people right now in these hospitals, so we don't know what will come of it. And I know that that application is currently pending down in Washington So we haven't seen anything as of yet as far as the result.
Let me just flesh this out a little bit. Blake Philippi said years ago, Partners wanted to come in, take over Care New England. Partners is partnered with Harvard. Brown didn't want Harvard anywhere near Rhode Island, and Lifespan didn't want Partners anywhere near Rhode Island, so the whole thing was torpedo. Is that true?
I don't know. I was not the speaker at the time, but I've heard that. I've heard Leader Filippi say that. You'd have to ask the principals who were involved at that time. But what I will tell you this is that Partners is here in Rhode Island. They have an affiliation with Kent Hospital right now, and there is a program where people are seen at Kent, and the doctors are reviewed at Partners in Boston and Brigham's. So there is some affiliation. We're not that far. We're only 40 miles away. As far as the merger goes, I don't think it's really appropriate for me to comment right now. The General Assembly has no role in this current process at all. It is being reviewed by the Department of Health, the Attorney General, and most importantly, by the FTC in Washington. So we'll let Washington make its decision. What I am generally concerned about is the President said two particular areas. Obviously, patient care. I want to make sure that quality, regardless of its partners or merger with Brown, Lifespan, and whomever comes in with Care New England, and we want to make sure, obviously, that the workers are protected as well. But patient care, hospitals are designed for one thing, to put high-quality patient care. We have to maintain that here in Rhode Island.
All right, we're down to our lightning round again, just about a minute and a half left. The nursing homes are complaining they may go broke, they may go out of business for a whole host of reasons. Any relief for them? Can you offer them any hope? We always have hope in Rhode Island.
I've met with the representatives of the industry. We talked about it. Obviously, they've been hurt with this, with the coronavirus, and so we're just having preliminary talks at this point in time. And any kind of relief, I would assume, would be contained in the budget at the appropriate time.
Back to you. This is the last topic. The Nilo Hotel is in your city of Warwick. It's a hotel, not a homeless shelter. It's become a homeless shelter, and the people nearby are pulling their hair out. The man says, I live across the street. This is not what I bargained for. Can you offer them any relief?
I can offer them an opportunity to present. I've met any kind of legislation they want. I will tell you that I've met with the councilman in the area, Councilman Sinapi. I have spoken to the mayor about it. I understand the city council will be sending the General Assembly some legislation. I don't know the details of that. I know they're concerned about notice. Homelessness is a problem, not only just in Warwick, but throughout the state. And we all have to do our fair share and our part for it. But I do sympathize with the neighbors, because I think the biggest problem with that situation was lack of notice. And I think that when you're going to put a facility like that in a community, the city should be notified so we can put appropriate public safety measures in place.
They have your ear. That's encouraging.
Absolutely, yes.
I want to thank you for coming. Speaker Shekarchi, Senate President Ruggerio. It's always good to have both of you on, a good, frank give and take.